The People's Republic of Bangladesh, with more than 172 million citizens, is one of the fastest growing economies in Asia. Over the past decades, the living conditions have significantly improved in Bangladesh, particularly life expectancy, infant mortality, and fertility rates. Bangladesh retains a deep commitment to social solidarity and a progressive development agenda, and has embraced the Sustainable Development Goals (SDGs), including SDG 3, addressing universal health coverage. The sailing towards this goal was smooth until November 2019, when the world was hit with the COVID-19 pandemic. All countries worldwide witnessed human suffering like never before. Bangladesh was no exception.
কোয়ারেন্টাইনে ৫ জন ৩ জনের কোভিড-19 শনাক্ত।
As the first COVID-19 case in the country was confirmed on March 8, 2020. The government promptly adopted response policies and all its partners joined the efforts. WHO immediately repurposed its staff at the national and field levels to address the needs, and over 75 surveillance and immunization medical officers were deployed throughout the country.
Since the very beginning of COVID-19 outbreak, WHO has tirelessly and closely working with the government of Bangladesh and the Ministry of Health and Family Welfare to support country's response to the pandemic. Addressing this health emergency became an immediate and a top priority. Most of our staff were rapidly repurposed to be part of the incident management team to help the government response to this outbreak. Once COVID-19 vaccines became available, WHO strongly focused on national rollout campaigns. In addition to other essential health services, the staff that continue to make critical impact, especially up to district and sub-district level in the country, are our surveillance and immunization medical officers. All SIMOs across the country were immediately repurposed to share up-to-date and accurate information and knowledge on the pandemic evolution to allow informed decision and adaptation to appropriate preventive measures. They supported the logistic in ensuring the sample collected reached the designated lab. They trained field health workers in line with the national and health system readiness and response to crisis. They closely worked with other partners to assess and fill critical gaps and deliver correct information to the public, raising awareness and fighting rumors and misinformation. SIMOs have always played a significant role in supporting the country in eradicating polio, protect children from measles and other vaccine-preventable diseases. Throughout the ongoing COVID-19 pandemic, our SIMOs have proven once again their dedication and commitment, being right there in the front line, in the field, protecting and saving lives. I am very proud and grateful to all the SIMOs and all our staff. Their outstanding and selfless service makes it possible for WHO to effectively support government and people of Bangladesh in responding to health crises and emergencies and saving lives.
In December 2020, this network, besides supporting COVID-19 response, also supported in planning and implementation of the measles rubella vaccination campaign, wherein we could successfully vaccinate more than 36 million children. I am thankful to Gavi and WHO for supporting this workforce in Bangladesh.
The COVID-19 vaccines started arriving in Bangladesh in January 2021, following the National Vaccination Plan formally launched on 27 January. The vaccines were firstly distributed to age groups prioritized by age and vulnerability. The countrywide rollout was then started on 7 February on a principle of equity.
When the vaccination was launched in February 2021, SIMO network tirelessly supported the government through technical guidance, capacity building and coordination to ensure the effective rollout of the COVID-19 vaccination in Bangladesh.
After the first COVID-19 case was confirmed in Bangladesh, I was assigned to support COVID-19 response along with EPI in Joshua district. When I was infected with this deadly virus for the first time in April 2020, I was much worried because it was not easy to stay away from my family with the fear of COVID. Besides that, all I missed my 6-year-old son Izan the most. During all these tough times, I continued to stay at my duty station and support government officials hope all our efforts will help to control the transmission of this disease. I just wish to see the day when all this will be behind us.
The lockdown in Bangladesh severely impacted the vaccination services, leading to almost a 20% drop in vaccination coverage. As part of the resumption of immunization services, the SIMO's network planned and trained more than 26,000 healthcare workers on infection prevention and control measures, immunization, and vaccine-preventable diseases surveillance.
So IBD SIMO network provides support to government, to the district and also divisional director during COVID pandemic. They not only provide support to COVID vaccination or COVID response, but also they provide support to immunization and also surveillance activities throughout the country.
Reaching and vaccinating the most vulnerable populations like the elderly, disabled people, the communities living in slums and refugee camps is always a priority. In Cox's Bazar, home to one of the largest refugee populations in the world, the COVID-19 National Deployment and Vaccination Plan has been rolled out, addressing the principles of equity and inclusiveness.
The start of the COVID vaccination in Rohingya camps was not easy. Registration and the vaccination card of the population was a big challenge, which was being overcome by developing a pre-printed vaccine cards. Door-to-door mobilization, awareness by the local community health workers and other partners made a lot of difference in the acceptance of the COVID-19 vaccination in this area.
Corona bahare baade Bangladesh maze corona bahare baade ki goji arate beshi doddol lagi corona bahare erar doddol lagi baade kengoji baade taka duwa maji taka mariare kengoji gammaza arangoje.
We feel so happy that the microplan that we developed with the support of local NGOs and partners resulted in huge turnout of beneficiaries in these vulnerable camps.
As of November 2021, the country has administered more than 95 million doses of COVID-19 vaccines. Under the leadership of the government of Bangladesh, the WHO SIMO's network continues to provide their priceless technical experience to reach the vulnerable populations in hard-to-reach and high-risk areas.
When scare and fear due to COVID-19 pandemic was at its peak, our WHO immunization and surveillance officers network were there on ground zero supporting the local authorities. This WHO IVD network continues to sustain, accelerate and innovate efforts supporting the government of Bangladesh to ensure that no one is left behind.